Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here, and today I'm going to talk about what is a crick in your neck. So if you sleep wrong and it just feels real sore, especially if you can turn really good one way, but you can't turn completely the other way. A lot of times what happens is there's just one little segment that doesn't move well. So I have a picture to help you understand. So that's the spinous processes, that's what you can feel, and then these are facet joints. So each of those sit on top of each other just like this, just like any other joint. Is actually a little bit more like this. But they kind of move as you move. So if there's one of those that just isn't moving, it causes a lot of pain. So when you go to move, you get pain, and then you get all these really big muscles kind of spasm down around it, and that makes it even less likely to move. So what do you do about this? Lots of different things to kind of get this moving again. Number one is don't be scared. Nothing's wrong. Don't have that fear component, because if you have that fear component, everything's going to stay pretty locked down. Try to move normally. Drink lots of water. Stretch if that's what feels good. A few things you can do if you have someone that is comfortable with some manual techniques, a massage therapist, or this is a point where a chiropractor actually may be pretty good to get that moving again if the muscles aren't too tight around it. But you can have someone just gently pull. That's called traction. It's a fairly easy technique that can kind of just let the brain know that it's okay in this area. You can do what we call snags. So you actually take and you block one of those little segments and you turn. And if you can get to the point where you can actually get range of motion while you have a segment blocked without pain, it's important that this doesn't hurt. So you start turning. If you get a point where you get good range or improved range and it doesn't hurt as much as it was without the block, just kind of putting a little bit of pressure right there beside the area that you can probably feel really tight muscles. Another good thing you can do is to lay down on a pretty flat surface with a Coke can or a water bottle or something cold and round, but kind of a little bit soft. Not real hard right there, and then take good deep breaths and kind of let that release. That's a technique. Ibuprofen's helpful sometimes in these situations. I haven't seen muscle relaxers be really effective, but the main thing I've seen is when people get this, if they're like, oh no, I just slept wrong, I'll be all right. Those people are all right. But when someone's like, oh no, something's wrong with my neck now, those people tend to have this for longer. So just know that it's okay. If none of these things I said today get you any relief, get in to see a physical therapist as soon as possible, and we can have some gentle techniques to get it going again, or maybe even a chiropractor can get that joint unlocked and get you moving better again. But always follow up. If you are manipulated, always follow up with full range of motion. Once you get that good range of motion, keep it by going slowly and gently through the range that is pain-free, just to keep those segments moving so they don't lock down again. I hope this is helpful. In any of these cases, you should always see somebody that knows what they're doing if it lasts longer than a few days. But again, don't let it worry you that something's going on, because that's just going to get that pain spasm cycle going and keep you flared up a little bit longer than hopefully if you kind of just keep on going about your business. Y'all have a wonderful Monday. Bye, y'all.